intestinal loops in left side of the chest and mediastinum has shifted to the right. So when obviously the intestinal loops will enter into the chest, most of the mediastinum will shift towards the opposite side. In fact, in cases when you hear the heart sound by putting the stethoscope, the heart sounds will not be heard on the left side, heart sounds will be heard on the right side, because the whole mediastinum has shifted towards the right. Why? Because the bowel loops have entered into the left side. And I told you, majority of diaphragmatic hernias which are on the left side are Boctelic hernias. Usually the diaphragmatic hernias which are on the right side are Morgagni hernias. So posterior and left-sided hernias are Boctelic hernias, anterior and right-sided hernias are usually Morgagni hernias. Next, complications in infant of diabetic mothers. So children who are born to diabetic mothers are prone to many complications. Now, just to make the things easier, there are many complications in infant of diabetic mother. Just to make the things easy, one of the mnemonics that you can remember, just to remember what are the complications seen in these children. So the mnemonic that you can remember is a low cost MRP. Low cost MRP is the mnemonic that you can remember to understand and remember the complications of infants in diabetic mothers. So you know all children who are born to diabetic mothers are prone to several complications. Not the mothers. Mothers are having complications because of diabetes. But a child who is born to a diabetic mother is also prone to several complications. And those complications can be given by the mnemonic low cost MRP. So let us see those complications. So the complication that starts from L is large for gestational age. If you go back to yesterday's class, when I was telling you small for gestational age, appropriate for gestational age, and large for gestational age, I told you large for gestational age is when birth weight is more than 90th percentile of the expected. When the birth weight is less than 10th percentile of the expected, it is small for gestational age. When the birth weight is between 10 to 90th percentile, it is appropriate for gestational age. Remember? So when the birth weight is more than 90th percentile of the expected, it is large for gestational age. So children who are born to diabetic mothers often are large for gestational age babies. I told you, one of the most common cause of large for gestational age is infants of diabetic mothers. Very rarely they present with small for gestational age. Majority of cases they present with large for gestational age. Then C, low cost MRP. C, what are the complications? C, congenital malformation. So there are certain congenital malformations that are present. Let us see those malformations. First, the most common organ system involved. Please hear carefully what I am saying. The most common system which is involved in infant of diabetic mothers is congenital heart disease. So cardiovascular system is the most common system involved, congenital heart disease. Now, there are three types of questions that are asked in congenital heart disease in infant of diabetic mothers. Which is the most common congenital heart disease in infant of diabetic mothers? Which is the most specific congenital heart disease in infant of diabetic mothers? And which is the least common congenital heart disease in infant of diabetic mothers? The most common congenital heart disease in infant of diabetic mothers is VSD. VSD stands for ventricular septal defect. What is the full form? Ventricular septal defect. So there is a defect in the ventricle septum. We'll talk about some of these heart diseases in the next chapter. So which is the most common congenital heart disease in infant of diabetic mothers? Ventricular septal defect. Which is the most specific complication? Now they are not asking most common complication. Which is the most specific complication in infant of diabetic mothers? Most specific congenital heart defect in infant of diabetic mothers. It is TGA. The full form of TGA is transposition of great arteries. What is the full form? Transposition of great arteries. So what is the full form of TGA? Transposition of great arteries. Normally, you know what happens is the aorta always arises from the left ventricle and the pulmonary artery arises from the right ventricle. But in some cases, the two main arteries are transposed. So now what is happening is the aorta, rather than arising from the left ventricle, is arising from the right ventricle. And the pulmonary artery, rather than arising from the right ventricle, is arising from the left ventricle. So the two main arteries are transposed. This disorder is known as transposition of great arteries. This is the most specific congenital heart defect in infant of diabetic mothers. And which is the least common congenital heart defect in infant of diabetic mothers? It is ASD, atrial septal defect. So whenever there is a defect in the ventricular septum, it is known as ventricular septal defect. Whenever there is a defect in the atrial septum, it is known as atrial septal defect. So which is the most common system affected in infant of diabetic mothers, organ system affected? It is the cardiovascular system. They are very commonly known to have congenital heart defects. The most common congenital heart defect in infant of diabetic mothers is a VSD. The least common congenital heart defect in infant of diabetic mothers is an ASD, atrial septal defect. And the most specific congenital heart defect in infant of diabetic mothers is TGA, also known as transposition of great arteries. Then overall, the most common congenital malformation which is seen in infant of diabetic mothers is neural tube defects. Please don't confuse. Please leave your pen and hear carefully what I am trying to say. Please hear carefully. The most common system, organ system involved, affected in infant of diabetic mothers is not the neurological system, not nervous system. It is the cardiovascular system. The complication in infant mothers is not congenital heart defects but neural tube defects. Right? Please don't get confused. They ask you which is the most common organ system affected in infant of diabetic mothers. It is not the nervous system, it is the cardiovascular system. And congenital heart disease are quite common. But if they ask you which is the most common complication, single complication in infant of diabetic mothers, then it is not a congenital heart defect, then it is a neural tube defects. Probably neural tube defects more common than congenital heart defects. But nervous system involvement, not that common. Among the nervous system involvement, majority of cases are usually neural tube defects. But cardiovascular system is much more commonly seen in these children. Right? Then a defect which is known as caudal regression syndrome is another type of congenital malformation. It is the most specific complication in infant of diabetic mothers. Please don't confuse. Most specific congenital heart defect in infant of diabetic mothers is transposition of great arteries. Most specific congenital heart defect. Like the most common congenital heart defect in infant of diabetic mothers is VSD, but the most common single complication is neural tube defects. Similarly, the most specific congenital heart defect in infant of diabetic mothers is transposition of great arteries, but the most specific single complication in these children is a caudal regression syndrome. It is also known as or sacral agenesis. It is also called as sacral agenesis. So as the name suggests, what happens here is the cervical vertebrae, the thoracic vertebrae, the lumbar vertebrae, they are all normal, but the sacral portion of the vertebral column, the sacral portion of the spine is all underdeveloped. That is why the name sacral agenesis. The sacral part of the spine is underdeveloped. Most of them have limb abnormalities. The legs are underdeveloped. So sacral portion of the spine underdeveloped, the lower limbs are also underdeveloped. So I am again repeating, please don't get confused. Most common organ system involved, cardiovascular system. Most common congenital heart disease, VSD. Most specific congenital heart disease, transposition of great arteries. Least common congenital heart disease, ASD, atrial septal defect. But the most common single complication is neural tube defect, and the most specific single complication is sacral agenesis or caudal regression syndrome.